Hello everybody, I am Dr. Vamsi Krishna, Consultant Urologist at Care Hospital, Banjara Hills, Hyderabad. So, today we will have a brief introduction about the HUGO Robotic Surgical System which we are using at our hospital, made by Medtronic company. So, to have a brief introduction, this is a master-slave robo. So, here basically there are three parts. One is the surgeon console, where a surgeon sits and operates. Second is a vision cart, where all the camera, energy systems and the monitor are there for the assistant to watch. And third is a patient side cart. So the patient side cart is brought near the anesthetized patient. There are 4 different carts, one for the camera for vision and 3 for the arms to be used for surgery. So these arms will replicate the exact movements what the surgeon makes at the surgeon's console, so that the same movements are again replicated inside the patient's body through a finer micro instruments. So this makes surgery far safer, easier and faster. For suppose traditionally we have to remove an organ which is infected or infested by cancer. So one has to make an incision wide enough to manipulate our hands, assistants, other instruments. So to bypass this incision, next came laparoscopy, where we put finer ports through which instruments are passed and the surgery is completed. So the next level is robotic surgery, where the same finer ports are utilized and a higher technology is used, wherein the instruments can have much more freedom to operate, more angles we can make, and more rotations or joints that we can make finer movements like suturing at smaller places, higher magnification, better visualization of blood vessels. All these are made possible by robotic surgery. This will make complex procedures to be done endoscopically or through a laparoscopy much easier compared to other traditional laparoscopy. And as compared to open surgery, we can make the procedure in a much smaller incision, giving the patient the benefit of having less blood loss, less operative time, faster recovery and overall better results. We have the experience of over 20 years of robotic surgeries being done all over the world. So there is no specific equipment related complication that has major complications that has happened. Whatever is the standard patient related, disease related complications which are comparable, and through many thousands of studies from different centers around the world, these studies showed the robotic surgery is not inferior to the traditional surgeries in most of the situations. So that turns out to be the efficacy of the procedure done through robotic is same as compared to the open surgery as for studies is compared. So but when we see the outcome to the patient, the lesser the incision, smaller the incision, faster the recovery, lesser the blood loss, automatically turns out to be a much favorable option for the patient. As we mentioned earlier, safety, it is proven to be the most safest option if the option is available for a particular surgery to be done. So first of all, there should be a perfect indication for a person to undergo robotic surgery. There should be a disease that requires surgical indication. Second, patient should be able to take anesthesia, whether he is fit to undergo anesthesia. Like robotic surgery needs a patient to be undergoing surgery under general anesthesia. If due to his cardiac status, lung status, any lung disease, cardiac disease, he is unable to undergo a procedure under general anesthesia, robotic surgery is not an option for him. So the second thing is, the robotic surgery needs the abdomen to be inflated with carbon dioxide, the gas. So if there are certain conditions in the abdomen which preclude this inflation of the abdomen with gas, like multiple previous surgeries or large hernias, or patient is having a severe lung problem, then also the patient is not fit for a robotic surgery. So we have to choose selectively which patient is the right candidate for a particular procedure like robotic surgery, then we have to appropriately use the surgical technology for the patient. As we have mentioned before, we are first discussing the surgeon console. So here the surgeon wears a designated 3D glasses. So because the surgeon is going to monitor a 3D screen. So this 3D gives a very big advantage in terms of better vision quality of procedure overall. So next is this what we call the joysticks for the surgeon. These are pistol grip joysticks. Whatever movement the surgeon makes here will be exactly replicated onto the patient side on the instrument arm. So these are the joysticks. There are different movements in this. So he can rotate the wrist completely fully. So whatever movements he is able to make with these joysticks, it will be replicated. So these are the movements that are possible. So he can use these buttons. There are different functions for these buttons. So these are the movements also. It's like opening and closing the jaws. These are rotations. These buttons are clutches. So, and these are buttons specially designated to fire certain staplers. So these are the different movements surgeon can use. So next is the foot pedal, wherein there are multiple pedals to control camera, zoom in, zoom out, to swap instruments, to use special energy devices like ligature, bipolar, monopolar. So all these are available for the surgeon, and there is a separate control unit for the surgeon where he can increase or decrease the speed of movement, fineness of the movement, degree of rotation of a movement. Here he can control the quality of vision, ergonomics, the positioning, everything he can control. Surgeon himself can control according to his wishes. So this is the main workstation for the surgeon in the robotic surgery here.